let's talk about the role of ultrasound in management of anterior abdominal wall hernia. What is a hernia? A hernia is a protrusion of an organ through an opening. When you talk about anterior abdominal wall hernia, it means there's an opening on the anterior abdominal wall, and either a bowel loop or a fat tissue could be protruding through this opening. Some of the symptoms, signs and symptoms of a hernia could be swelling on the abdominal wall. It could be vomiting. It could be generalized abdominal pain. And once you have these symptoms, you'll go to the hospital, and when you go to the hospital, they'll tell you to do an ultrasound. And why do we do an ultrasound? To rule out a hernia. We just want to make sure that the swelling that you're having on the anterior abdominal wall is a hernia. It could be other things. It could be lipomas, other things that could cause the swelling. But again, we just want to rule out. We just want to make sure that what we're dealing with is a hernia. So once we make sure that it's a hernia, again, we want to make sure that the hernia is not obstructed. What does that mean? It means once we have bowel loops going through an opening, sometimes it will go in and sometimes it will come out. But sometimes it will go in and then it twists, then it obstructs the flow of the content of the bowel loops. So once this happens, you'll end up having intestinal obstruction, which will cause you to have severe abdominal pain and vomiting. If this is the case, then a medical intervention is supposed to be found, so that a solution is supposed to be found, so that at least we can untwist and we can make sure that the obstruction is sorted out. The next thing is we want to rule out something called strangulated hernia. Strangulated hernia means once the bowel loops go through the opening and it twists, sometimes the blood flow on the wall of the bowel loop is compromised. We'll not have blood flow on the wall of the bowel loop. So we'll end up having a dead tissue on the bowel loop. And this can be complicated. This could be a complicated case to handle. And all these will depend on the duration between the diagnosis and the treatment of this hernia. So why I'm speaking to you is, if we can have this thing diagnosed earlier and treatment done earlier, then the complication of these hernias could be reduced. And hernias could be anywhere on the anterior abdominal wall. It could be at the umbilical region, at the paraumbilical region. It could be in the inguinal region, or it could be in the inguinal going to the scrotum. So once you have all this swelling, or once you think you have this condition, kindly visit our hospital, so that at least we can see what exactly is happening, so that if it's a hernia, it can be sorted out. And that is exactly what we are all about, just to make sure that we improve the quality of our life. If we can detect these things earlier before they go into obstruction or strangulation, then I'm sure we can save our life. Once again, I've always said God has given us these technologies so that at least we can help improve the quality of life of our brothers and our sisters. And our faith has always been that even if some of these conditions are found, you're going to be healed and you're going to be better. God has given us this information so that at least we can help you. We can use us to help you. We only practice what you've been given, but the healer is God. So my prayer has always been, if this thing can be detected earlier, or we can diagnose some of this condition, you're going to get treatment and you're going to be better. Your life is going to be back to normal. So once again, thank you for following me. Thank you for always for your comments. It always encourages me to keep on moving and to keep on pushing. Thank you. And even as my desire has always been to improve the quality of life. My desire has always been, what can we do just to reduce the burden of some of these diseases? So thank you very much for just getting time to listen to me, and have a great day ahead.